Hi class, Meredith Burke here. I want to ask you some questions and I want you to take them seriously. Have you ever hurt so badly that you wanted to die? I have. Sometimes I deal with emotional pain on a daily basis. I get up in the morning and tell myself today I will live to glorify God, and that gives me purpose to live one more day. But today I don't want to talk about my pain. I want to talk about the pain and suffering of the terminally ill. I will convince you that euthanasia, or physician-assisted suicide, should be legalized. I have witnessed the diagnosis and death of 3 family members. All 3 of them were diagnosed with painful, incurable diseases, and I watched them suffer and waste away. As you age, you too will face the inevitability of death. Death of your parents, your siblings, your friends, your spouse. If you were diagnosed with a painful terminal illness, would you want to suffer needlessly? What about your spouse? Euthanasia, or physician-assisted suicide, would give you or your spouse the right to choose how to die. If legalized, you could choose to end your needless suffering. Let me tell you how euthanasia, or physician-assisted suicide, is reasonable, ethical, and moral. Currently, in 46 of our United States, helping someone to die is considered homicide, except in Montana, Oregon, Vermont, and Washington. How can helping someone die be reasonable? Well, federal Judge Neil Gorsuch states in his article, The Right to Assisted Suicide and Euthanasia, that the law should sanction ending the life of those suffering from incurable and extremely painful diseases. Even today, refusing to accept life-sustaining medical care is common in the state of Texas. In the Journal of Loss and Trauma, the article Physician-Assisted Death and Its Relationship to the Human Services Professions, John Westerfield reveals that 4 states are considering or already have legislation submitted for the approval of physician-assisted death. These proposed laws contain specific criteria to prevent the misuse or abuse of this assistance. Due to the obvious aging of our population, your parents and mine, the number of patient requests for assisted death is increasing. Other states and countries are legalizing physician-assisted death. I watched my dad shrivel to a skeleton over the period of 18 months after his diagnosis of lung cancer. It was a horrible process, watching the cancer eat through his rib cage, and excruciatingly painful for him to endure. Legalizing physician-assisted death becomes very reasonable when you have to watch your loved one continue to suffer. Along with being reasonable, physician-assisted death is also ethical. Based on the Hippocratic Oath, physicians are to do no harm. Many treatments for cancer and other diseases cause more suffering than the disease itself. Consider the importance of quality of life. Continued nausea, vomiting, diarrhea, severe constipation, increasing weakness, loss of function, and loss of control. All of these characteristics significantly increases the patient's need and right to die with dignity. According to Dr. Robert Perlman, in his book, Physician-Assisted Dying, The Case for Palliative Care and Patient Choice. Furthermore, Dr. Perlman insists that honoring a patient's desire to control the circumstances of his impending death, including dying at home, is the ethical thing to do. Finally, legalizing physician-assisted death is the moral thing to do, and Tal Bergman-Levi supports that both medical physicians and psychiatrists realize that they need and have the moral duty to provide assisted services in dying when both the patient and the patient's family are ready for the never-ending suffering to stop. He states this in his article, Attitudes Toward Euthanasia and Assisted Suicide, a comparison between psychiatrists and other physicians. If I'm in a situation where my death would bring me release from constant pain and suffering, and there is no cure or relief available, I want the choice to experience death with dignity. What about you? Do you want to be able to choose? Listen carefully. This is what you need to do. Do you know who your state representative is? Find out. I have included the website you can use to find your representative. Call him or her, or better, pick up a pen and a piece of paper and write to them. Express your concerns. Demand legislation. Even Desmond Tutu supports the right to assisted dying. In his "A Dignified Death is Our Right." He believes that life is precious, but quality of life is to be valued above quantity of life. We must work together to change the legality of physician-assisted death before it's too late, for your parents and for you. Legalizing physician-assisted death is the reasonable, ethical, and moral thing to do. Thank you for listening.